This is the first case to remember. He was 48 years male with hematemesis. He was in hemodynamic shock. And after stabilizing, we scope him and this lesion. It's a very obvious apparent vessel on normal underlying mucosa. It is a Delafoy lesion. He was actively bleeding, but after flush and clipping, he was controlled and remained stable. So the first case was Delafoy lesion. The second case, if you remember, it was 25 years male who presented with dysphagia. As I mentioned, there is nothing to suggest reflux symptom, no drugs, no other alarming symptom. And obviously what was seen in the lower esophagus, this whitish to yellowish submucosal lesion was normal overlying mucosa. And actually biopsy was done for this lesion, which showed quite obvious normal squamous epithelium for esophagus, and this large polygonal cells with a lot of eosinophilic granule. And as I mentioned yesterday, was S100 protein stain, which is a stain for nerve cell, was positive. So it is a granular cell tumor of the esophagus. I know it was quite uncommon, but usually they are male, younger, with dysphagia, and submucosa, normal mucosa with yellowish, as I mentioned, white to whitish plaque. The clue was in the biopsy was positive stain. Usually it can be diagnosed by biopsy, and EOS will be also beneficial to see this submucosal lesion, which is usually isoechoic to hyperechoic lesion. Case number 3, the same like case 1, we present with massive upper GI bleed, and he was hemodynamically unstable, and he had the same bleed 3 months earlier in other hospital. This is a fundic view. You can see clearly the grape-like, which is fundal varices. It was isolated fundal varices, and the closer view, actually it ruptured and ulcerated. So the answer was ruptured, ulcerated gastric varices. Case number 4, that was a young lady on CellCept for autoimmune hepatitis, which was controlled for quite some time, present with 4 months history of bloody diarrhea and lower abdominal pain. This is image. Very obviously the mucosa looks abnormal, granular, with loss of normal vascular pattern, and as I mentioned, this lesion was started to appear, further little progression upon endoscopy, the lesion getting worse and start to bleed, and this is the flash after that. So it was a mucosal tear, almost serosal tear in background of ulcerative colitis. Actually, we went to literature, is not commonly described in ulcerative colitis. Either this mucosal or serosal tear, usually it could be complication with air inflation for normal colonoscopy, and has been reported with collagenous colitis. And biopsy confirmed ulcerative colitis. Case number 5 was long-standing IBS, young with recent onset of hematochezia. There is no other family history of any colonic disease. And this is the lesion, a rectal lesion, which is obviously a polyp-like lesion, but on getting a closer view, it was a center dimpling and normal overlying mucosa, actually after raising it, a resection, but endoscopy diagnosis submucosal lesion, but after raising with saline and resection, it came to be rectal carcinoid. So it was a rectal carcinoid. So anyone, just name it a submucosal lesion was a correct answer. It's not a polyp. And thank you.